let's see, if anyone has any questions about AMH and fertility, let me know. Someone has a question about endometrioma, and that one I can answer because that an endometrioma is like, it's a type of cyst that grows on the ovary. The ovary is where all your eggs are. So I have seen women with endometriomas or endometriosis have low AMH, basically because the cyst is taking over a part of the ovary where the eggs would be. So sometimes I've seen women with endometriomas who have lower AMH. You don't always want to go to surgery as your first option if fertility is your main goal, because when you do surgery and remove a cyst on the ovary, then you automatically strip away a lot of eggs. You just really can't avoid it when you're removing a cyst or a part of the ovary, that you strip away a lot of eggs. So your egg supply will usually go down after you remove a cyst on the ovary. So sometimes you have to remove a cyst because of pain, or because the ovary is twisting, because the ovary is on basically like a thin stalk, and if you have a cyst it can twist and it hurt the blood supply to the ovary. So there are reasons that you would need to do surgery, but it's not always a first choice for fertility, because again, it's likely going to lower your AMH, and it's AMH, your egg supply, once it's lowered, you can't get it back. So that's why we're always really careful before recommending surgery, because that will happen to lower your AMH. So after you remove an ovarian cyst. Can I retrieve and freeze eggs prior to surgery? Yeah, I mean, it depends what type of surgery and the timing, but yes, you can retrieve and freeze eggs before surgery. For women with low AMH, that's something that I didn't mention in my other talk, is that that is an option if you're not ready to get pregnant in the moment or create embryos, but you do have low AMH, then you can freeze your eggs, because you can preserve some of those eggs that you have, and you know this will get worse with time, where your egg supply and your AMH will get worse with time. So if you already have low AMH, like I recently had a patient, she was in her early 30s, but she had really low AMH, and she did a few cycles of egg freezing, even though she did not want to get pregnant anytime soon, so that she could preserve her eggs, which she knew she would lose. She may not respond to fertility treatments in the future because her AMH was so low. So she was able to do a few rounds of egg freezing and freeze a good number of eggs so that she could use them in the future. So again, depending what type of surgery, yes, you can freeze eggs. Someone with low AMH do freeze their eggs to preserve those eggs that they have, that they know they will lose with time. So that's an important thing to talk about, is egg freezing with low AMH. That is definitely an option. Hello. All right. Let's see. So today I'm talking about low AMH and fertility, low egg reserve, IVF with low egg reserve. So let me know if you have any questions, especially about low egg reserve and AMH, low AMH and hypothyroidism. Possibly, yes, possibly they're related. So low AMH or low egg reserve will happen naturally as you get older. So it's natural to have low AMH at age 40 or over age 40. Your AMH will naturally be lower because your egg supply naturally decreases, and it dramatically decreases with age. But it's not as common to have low AMH when you're young. Although I do treat a lot of patients who have low AMH when they're young, but that's not as common. Usually we are looking for another cause, something we look for that can be associated with low AMH when you're young, or another name for it is premature ovarian insufficiency, or POI, is hypothyroidism. So we do look for hypothyroidism in young women with low AMH or POI. So there is some relationship between those two. Yes. Okay, so let me know if you have any questions specifically about low egg reserve. Okay, here's one. DOR, which means decreased ovarian reserve, or low egg reserve, likely low AMH as well. Age 40 and 4 eggs, or it sounds like embryos, because it sounds like maybe they're blastocyst embryos. And so it sounds like maybe you did IVF and you got 4 eggs, 4 embryos, let's say 4 embryos, and 3 are day 5 and 1 is day 6. So that's good. How likely are they to be normal? So the thing with embryos is that eggs can fertilize and grow, and they look totally normal and they grow really well for 5 or 6 days, but you don't know is what's our viability of those eggs without doing that check called PGTA to know which of those eggs are likely to be viable. If you don't do the PGTA, then we just base it on your age. So at your age, you would expect maybe say 20% of embryos to be viable that make it to day 5 or 6. So if you have those 4, then we hope that maybe 1 has viability out of those 4. That's sort of how, and that goes, now we're speaking more about quality and how well the eggs work, but that's what we might expect in your case. But I've seen variation. This is just an average. So have I ever seen more than 1 viable in a woman age 40 with 4 blastocysts? Yes, I have, but I've also seen sometimes none of them are viable. So there can be a range. On average, I would say I would expect 1 out of 4 to have viability of blastocyst embryos in a 40-year-old. Okay. And AMH 1.55 or 11, probably 1.55 at 40 years old. That sounds about normal. And AFC was 10 to 18. So she's saying that 10 to 18 small eggs were seen on her ovary, 4 eggs retrieved. So, I mean, that's a touch low. For that AMH and AFC, you would expect maybe to collect a few more eggs, but 4 blastocysts is great. That's a question, but they were 29 with the AMH of 1.5. That's a touch low for being in your 20s. It's still at the lower end of normal range, but it's a touch low. I might look into that further, either by getting an ultrasound to look at your antral follicle count or repeating your AMH. Sometimes if you've been a long time on birth control, you can get a little bit lower reading on your AMH. Okay. Let's see, age 35, AMH of 0.17, so that's low. But 3 rounds of IVF and 3 embryos. When do you move on to donor eggs? Okay, so with 3 rounds of IVF, you got 3 embryos, but they were all lower quality. It kind of depends what the reading is, because there are some embryos that, if they're lower quality, or depending on the type of aneuploidy, it's not as black and white as we used to think, that there are some aneuploidy embryos that do have a chance of viability. So it depends what type of aneuploidy, I would say, which would help me answer the question more, but is it time to move on to donor eggs? So donor eggs are usually from, let's say, from anonymous egg donor. They're age 32 or younger. They're screened usually by their AMH to make sure they have a normal AMH. So it's expected that their embryos would have a higher euploid or viability rate. So after 3 rounds of IVF, it's reasonable to consider that option. I would like some more, I would ask more questions, say if you had a consult with me about your embryos and about your IVF cycle, so I could understand a little better, to think if there was any adjustments that could be done with your IVF to give you a better outcome, or to make sure any of your embryos have any viability as well. Okay, let's see. So thank you for all your questions. Today I'm talking about low AMH or low egg reserve and fertility and IVF. So I'm trying to answer questions about that. I have IVF scheduled for the end of February. I'm 33 with an AMH of 3.9. So that's good. That's a AMH normal to high AMH. So you should, I wouldn't worry. I would think you would get a good number of eggs, and based on your age and AMH, I think you should have good success with your IVF cycle. Okay. And Laura's saying she's doing, I think we were 40 and you got 4 blastocysts. You were hoping for more embryos. It's not unreasonable to have more embryos, because like I was saying before, when you're at age 40, maybe on average 1 in 4, 1 in 5 are expected to have viability. Scared to do the testing. That's to check the chromosome number. So you could tell me more like why you're scared to do the testing. It can be helpful at age 40 or older because it lets you know as you're collecting embryos which ones are likely to have viability. So it gives you some idea, better than just what I'm predicting based on your age. The downside of the testing is it's expensive and insurance doesn't usually cover it. How can you increase your AMH? You can't really increase your AMH. Yeah, birth control can suppress it. So sometimes if you come off, you'll see your AMH higher off of birth control. But AMH is a measurement of your egg supply or your egg reserve, which is what you're born with and was what decreases with time. So once it's lower, you can't get it back or increase it, unfortunately. But it doesn't mean you don't have options. You do have options. So, you know, something that I use in my patients is ovarian PRP. So that's something that's used like before fertility treatment. They're showing some promise in increasing AMH, but it's not something that you can just increase. You do want to then consider what your options are because AMH will get lower with time. So it's something where if you're thinking of getting pregnant, you would want to have a full fertility workup. And if you're not getting pregnant after a few months, you would want to see a fertility doctor to look at ways to increase your fertility. And if you're not thinking of getting pregnant and you know you have a low AMH, you may want to consider speaking to your doctor about freezing your eggs so that you can preserve some of your eggs before your AMH gets worse, you know, depending on the level, depending on your age. But that is something I would recommend. Let's see. So you can't raise your AMH, but if you have low AMH, I would take it seriously and get a full fertility workup and discuss what your options are depending what your goals are currently. You're welcome. What about high AMH but no PCOS? So high AMH means that your your antral follicle count or the eggs in your ovaries are high. Oftentimes it does go along with PCOS, but it doesn't have to. Just because you have high AMH doesn't mean that you have PCOS. It just means you have a good egg supply. So if you're not, if you're having issues with fertility, we have to consider high AMH like when we're dosing medications for fertility treatment because you can easily over-respond to medications. If you haven't, get a full fertility workup and discuss what your options are depending what your goals are currently. You're welcome. What about high AMH but no PCOS? So high AMH means that your your antral follicle count or the eggs in your ovaries are high. Oftentimes it does go along with PCOS, but it doesn't have to. Just because you have high AMH doesn't mean that you have PCOS. It just means you have a good egg supply. So if you're not, if you're having issues with fertility, we have to consider high AMH like when we're dosing medications for fertility treatment because you can easily over-respond to medications. If you have high AMH and you're not getting pregnant, it's something to look into further. But basically it just means you have a high egg supply. Sometimes it can be a sign of a hormone imbalance though, like PCOS. So, if you're having any symptoms like irregular periods, acne, difficulty getting pregnant, it would be something to look into more. Okay, and AMH 1.7, 30-year-old, good antral follicle count, that's good. AMH 1.7 is the lower end of normal around age 30. It's not a perfect test. So if your antral follicle count is good, I would almost go more by that than by your AMH, just because AMH is not a perfect test. A lot of times I repeated it on my patients and gotten a slightly different result the second time that we've checked it. And if I see a good antral follicle count, which is done on a transvaginal ultrasound, you check each ovary and you count the number of eggs you can see in each ovary. And if that count is good, like for a 30-year-old, maybe you would see 5 or 6 eggs in each ovary, that would be considered a good antral follicle count, then I'm not as concerned that the AMH was on the lower end of normal. I'm more thinking that maybe that AMH just wasn't super accurate for you. So that's why it is good to look into it further if your AMH is on the lower end. Okay, let me see. Let's see. 27-year-old in school with 3.5 years left. Would you suggest now rather than waiting? I'm not sure I caught the first part of your question, but I would suggest it never hurts to get your egg reserve. Basically, it's like a fertility check in a way, getting your AMH checked just so you know what your where your fertility is at, especially if you're delaying getting pregnant due to like law school. It's something to consider so you know where you're at, so you know, okay, my AMH is fine, it's okay for me to delay. Let's see. And let me look here. So someone has an AMH but no regular periods. So you definitely want to be getting regular periods. If you're not getting regular periods and you're not on birth control, then you want to sort that out. And because your AMH level is lower, then that can be let me just see. Yeah, so I think you're maybe outside of the US because we measure it slightly differently at a slightly different level, but that would maybe correspond to an AMH of 0.2. So you want to get regular periods because depending, I think you're 36 years old. Yeah, so you want to get regular periods because as the egg grows, it makes estrogen and hormones for your body, and that's natural for your body to have until age 50. So if you're not getting periods, that could be because your egg reserve is low, because your AMH is low. So you would want that, even if you're not interested in fertility, just for your health, it's important to get that checked because until about age 50, it's normal to have regular periods. And if you're not having regular periods, yes, you should definitely get that checked out. Let's see. Oops. Saying I have an ovulation app and my highest percentage was 0.7. I'm not sure. I'm not super familiar with that app. Let's see. So today I'm talking about low AMH, low egg reserve, and IVF treatment or fertility treatment with low egg reserve. And so let me know if you have any questions about low AMH or low egg reserve and fertility or fertility treatment. Trish says AMH 0.19, so that's low. Age is 35, 3 failed IUIs, but I was getting good follicles. Yeah, so that's a low AMH. I'm not sure. Again, I always like to do the full check and make sure what's your antral follicle count to make sure that's accurate, but that sounds really low for age 35 if it's 0.19. So you may want to consider moving on to IVF because IVF works a lot better than IUI. So the per treatment success is higher with IVF because the egg is collected, fertilized, it has to grow. And when your AMH is really low, you don't have as much time, especially if you've failed 3 IUIs, then you want to move on to something that will work better for you, have a higher chance of pregnancy and higher success rate. Let's see. Okay, so I had a living kidney transplant in July of 2024. 24 years old. Is there a time frame I should wait? So I would say check your AMH so that you know where your fertility's at, and that will help you know if you should wait or you should move forward. Let's see. There's a possibility it can be inaccurate. I think you're talking about AMH. Yeah, AMH can sometimes be not 100% accurate. So it's a blood test, and like any blood test, it's not perfect, honestly. It's useful. It's really useful because it can be measured at any point in your cycle, but it's not 100% perfect. It can be inaccurate. That's why I've seen it be inaccurate sometimes, where I was concerned it was low on a patient. I checked on ultrasound and her egg count was good, her antral follicle count was good, and so then say we rechecked the AMH and it was better on a recheck. So it's not 100% a perfect test. but you know, you want to get other checks or measures if your AMH is low. So maybe check your egg count on ultrasound or recheck your AMH. Let's see. You're welcome. So I'm trying to focus the questions today on low egg reserve, low AMH, and fertility treatment, or any fertility questions, or any questions about low AMH or low egg reserve. So let me know if you have any questions about that today, and I will try to schedule a more general question and answer, because I know everyone has so many good questions. Let's see. Let me see if anyone has any questions about low egg reserve or low AMH, and thank you all for all your questions. Okay. Trying to conceive for a year, AMH is 1.7, age 30, so that all sounds good. A clear HSG, so that means your fallopian tubes were checked and they were open. Hysteroscopy showed a polyp. So a polyp is a little overgrowth in the uterus or in the endometrial lining, so that can lower your fertility. So you want to make sure that was removed at your hysteroscopy. But your AMH looks good and your age looks good, so I would think your fertility is good. But make sure the polyp was removed at the hysteroscopy. Exceedingly difficult after about, it depends, for each woman it's a little different, but maybe around age 44 it becomes very, very difficult, and extremely difficult for women to get pregnant with their own eggs after age about 46. Because you still have eggs and you would still have a measurable AMH, but when we go to ask those eggs to fertilize and grow, they just can't do it. They make too many mistakes. So that's why the quality issue.